second here. Okay, Jacob. So, how long have you had Tourette's for?
I've had it ever since since I was diagnosed with it when I was like 4 years old. Yeah.
Very good. And has it changed at all over time?
Yeah.
Tourette's is not life-threatening, but Tourette's is life-altering. It can absolutely shut a person down. He was just shut in his room. And Jacob is such a smart, bright guy, and he has so much to offer to the world. And yet this thing that he has, Tourette's, was just dominating him. And he didn't think he could go to school. He was homeschooled. He couldn't go to college. He didn't want to go out to restaurants.
His Tourette's was pretty mild up until about 9 or 10 years old, and he had to be put in the hospital. And then he also would bang with his fist on people or throw pencils, so it really hindered him, starting in elementary, about the 5th grade. As Jacob graduated from high school, he developed a real severe vocal tic, where he could not communicate with anyone, even his friends on the phone. And I saw him getting more depressed and more isolated. The vocal tic he has now, it's a real deep clearing of the throat that he cannot control. And then he has the rolling of the eyes along with that.
The vocal tics started to just get so bad that I can't even socialize anymore. And I've been feeling really lonely. I'd say that we were starting to feel desperate, yeah.
As Jacob said, we did get a little bit desperate there at the end, just recently. When he graduated and started with this major vocal tic, he did not want anything to do with college or moving forward. I kept thinking it was going to pass, and it hasn't. And as he got more and more depressed, I was just searching everything possible out there. His psychiatrist just said there's nothing else we can do. Jake, you ready, babe?
And this is not a cure for Tourette's, but a treatment for Tourette's. And what we'd like to do is reduce his symptoms. We'd like to just give him hope to have a normal life again. And what we're doing is following our TMD protocol. And TMD means things that when people have trouble with their bite, temporal mandibular disorder. And by following through a very scientific, objective protocol, we're reducing the problems that are in his body. Not just his bite, but it affects his posture and things like that. And what the hope is that as we reduce the amount of bad information going from his posture to his brain, it'll reduce the tics that he has with Tourette's. So we're doing some more adjustments here. Another appointment, and about halfway through our protocol. So what we like to do first is find out where his bite should be, and that means to find out where the jaw lines up, where the teeth are lined up, where the muscles are lined up, where the central nervous system is comfortable, even his posture, airway, and other things as well. Once we line that up using our computers, then what we need to do is make something called an orthotic that he wears. Once he's wearing that, then we want to make sure that that bite is very, very dialed in and very comfortable to him. The amount of information that the brain records from the bite is very, very detailed. It's very exquisite, the amount of sensory input that the teeth get and relate to the brain. So that takes several steps as well. As this is going on, his body's feeling better, his posture's getting better, and then the symptoms are starting to reduce.
All right. See ya.
See ya.
Bye.
Bye-bye.
And we're going to try this, and Jacob has a lot of hope, and I have a lot of hope for it.
So we saw Jacob at the 6-month mark, and he had an 84% reduction. We were super excited about that.
He's had a lot of relief from the vocal tics and the vocal spasms, and I attribute that to Dr. Hale's treatment and the help he's given him.
But about a month after that, he came into my office for just a routine dental cleaning, and he was in my office for about 90 minutes. And when he was in the office for 90 minutes, he was talking and laughing and just like deep laughing, and he had 2 tics in 90 minutes in my office for dental cleaning. It was phenomenal. We were just amazed. I mean, I had to make sure that was Jacob.
And now he has dreams and aspirations of becoming a professor of English. He does creative writing. He's written a book, and he's written poetry, and he's going to continue on with that. So I'm really excited for him as far as education. You know, at this point, he's wanting to get his college degree now, where at one point he did not want to do that.
And I'm actually able to communicate with people now, because like before, you know, I think it was like 8 months ago or something when I first got here, I wasn't able to talk at all.
Yeah.
But yeah, I'm able to actually talk now. I clear my throat every now and then still, but I'm able to talk enough now to have a conversation with people, so and make friends, you know.
So I'm very excited to just kind of, you know, get him restored back to society, if you will, by getting the Tourette's under control. Now, there's no cure for Tourette's, and this didn't cure his Tourette's, but it significantly reduced them so that now he's got hope again. He's interacting. He's doing the things that a 20-year-old man should do. He's going to college. He's interacting with friends. He's had his hope restored.